Educational content. Module 3. The return home. In this module, we will see how to resume daily activities on the return home and how some adaptations of the environment and the use of therapeutic support devices can help with this return. The recommendation is to start performing daily activities 24 to 48 hours after returning home from a hip fracture operation. Daily activities should begin 24 hours after a hip fracture operation. The initial activities the patient can do are very simple activities like washing their hands, eating, and brushing their teeth. Activities that are a little more complicated and that involve the legs can also be started after 24 hours, although they may need help from the caregiver. This help may be greater at first, but as the days go by, this help will be withdrawn until the person is entirely confident about doing these activities on their own and finds it easy to perform them. The more active the person is, the faster the recovery process will be. Another important aspect is adapting the physical environment in the home. This will be essential to promote an active and safe recovery. The right furniture layout and the presence of wide spaces to move around the home will help prevent falls and/or injuries. It is important to remove any unnecessary decorative objects or obstacles you might knock into. Some of the most common adjustments that will help make the home safe are removing floor rugs to prevent tripping and falling, lifting loose cables off the ground in the areas where the patient will walk, fitting banisters on both sides of the stairs for support, avoiding wet and slippery floors to prevent possible falls, having good lighting, especially in areas such as the staircase to avoid tripping. Therapeutic support devices. Knowing about and using these devices can help with performing daily activities in a safer and more independent way. Raised toilet seat. Long-handled grabber tool. There are many useful therapeutic support devices that can be chosen depending on the needs of each person. You should be taught how to use them by an occupational therapist.
Los dispositivos de apoyo más recomendables son el alza para el váter.
The most recommended support devices are the raised toilet seat, especially when a hip prosthesis has been fitted, but in other types of treatment as well, because it will make it easier for the person to get up from and sit down on the toilet. It is also important to have armrests or grab bars close by so that the person can easily pull themselves up. Other devices that we can use are long-handled grabbers, which will help us get hold of shoes, clothing, or objects that may have fallen on the floor. Long-handled shoe horns for putting on shoes, and also sock aids are different types of help that will make it easier to do daily activities. However, it is also important that an occupational therapist starts using these so that they are much easier to introduce into the daily routine. There are a huge number of different devices, and whether they are required or not will depend on the needs of each person.
Dependerá de las necesidades de cada persona si son necesarios o no.
Example of the use of therapeutic support devices for dressing. Key ideas: early resumption of daily activities on return home, adapting your physical environment to promote a safe recovery, use of therapeutic support devices to help perform daily activities.